Hey everybody, it is indeed me, Jay Baer. So delighted to be with you to kick off this fantastic event. And as we get started, just a quick note of thanks from me, my team, my family. The work that you're doing right now is truly remarkable. It is not a set of circumstances that anybody would wish for, and I know just how hard each and every one of you are working, and your teams are working to try to keep us all safe. So thank you very, very much for the work that you're doing. Obviously, things are tricky for you out there as they are for a lot of folks, but maybe nowhere more so than in your industry. Increased costs for PPE, among other things. You've got delayed procedures all over the place. And of course, now Medicare payment advance issues. It is a difficult proposition. I'm going to hope to give you some advice and counsel today on things that you can do in your organization to try and get through this crisis that we find ourselves in. I've done a lot of work with hospitals, as many of you know, and actually right now, my team and I are working with the University of Arizona on the rollout of COVID Watch. We're their first ever university to use COVID Watch, which is a exposure notifications app. And so we're going through a lot of challenges and research and positioning around messaging, marketing, how to get people to better understand this app, and frankly, how to get them to trust the app, which is very similar to the challenge that you're really faced with, even as the pandemic hopefully subsides, which is how to rebuild confidence and trust in your facilities and your services amongst your longstanding customers. See, right now, we're in this strange place. I think it's unprecedented, really, in my long career. It's an unprecedented information asymmetry. You know things that your potential customers don't know. And they suspect things that may or may not be true, and the two can't sort of get lined up. It's a very tricky proposition indeed. And what happens when there is an information asymmetry, this is most commonly seen on the battlefield. You've heard of the fog of war. Right now, we sort of have the fog of COVID informationally. And what happens in a circumstance of information asymmetry is it's a breeding ground, it's a petri dish, if you will, for rumor, for confusion, and because nobody's really certain what the circumstances actually are, it stops, it halts action. So even if you were predisposed to going in for a medical procedure as a potential patient or caregiver, you're like, I'm not 100% confident, so I'm just going to wait that out until this information asymmetry subsides. But it's not subsiding. If anything, it is being exacerbated. So what I'd like you to consider is how we can all use communication and customer experience to create new conversations that transcend this information asymmetry. Now, throughout this presentation, you will hear me say customer experience because that is the lingua franca of the industry. But of course, I mean patient experience, caregiver experience, in some cases even physician experience, etc. But just know that we are on the same page there. It's just easier to say customer experience because that's what we tend to say in the game, so to speak. Yeah. What we're hearing from patients now, even those who have been with you for years and years and years under a variety of different circumstances, are things like, I'm not sure I'm ready. I'm not sure I'm ready to go back to the surgery center or the hospital or the physician's group to get some procedure done. I just don't know if I'm ready. And it's interesting because that is not driven necessarily by the acuteness or lack thereof of their medical condition. It again is driven by this information asymmetry. What we want them to say instead of, I'm not sure I'm ready. What we want them to say instead, friends, is, I heard from somebody else, my friend or my friend's friend. I heard, and she went to the surgery center and had a procedure done recently, and she said it was incredibly safe and incredibly easy. The good news, my friends, is that you are not alone. Today, every business, whether you're in the medical business, whether you're in the higher education business, whether you're in the consulting business, whether you're in the restaurant business or the tire sales business, it doesn't matter. If you're in the space shuttle business, today, every business has to operate like a startup. Every business has to operate like a startup. We have to fundamentally rewire all of our customer, in your case, patient and caregiver relationships, even those relationships that have been present for years and years and years, because we've all sort of been put into a snow globe and been shaken up. And that shaking process has created a circumstance where nobody knows nothing about nothing. Nobody knows nothing about nothing anymore. The bad news is the people who are the most loyal to you may not be loyal to you anymore. The good news is you may be able to create an entirely new set of relationships that wouldn't have been possible pre-pandemic. In fact, some interesting research from Podium found that 60% of customers have used a business for the very first time since the pandemic. That is certainly true for me, and I'll bet you it's true for many of you as well. And it's not as if my family and I sat down and got out a yellow pad and said, okay, who do we want to patronize now that we haven't in the past? And let's change all of our suppliers, if you will. We didn't do that. It just happened naturally, partially because there are now people we are more confident in from a safety standpoint than we were in the past. There are certainly businesses that we are less confident in than we were in the past. And a lot of it's driven by word of mouth, what we hear from friends and family members just like you. Perhaps even more interesting is of that 60% of consumers who have selected a new product, service, business since the pandemic, nearly 9 out of 10 of them suggest that they will stay with that new business. They will stay with that new business. So market share is shifting like never before in a way that frankly would have been unthinkable 6 months ago, truly unthinkable. So while everything about this pandemic is terrible and nobody knows that more than you, hear me when I tell you that quite literally, this may in fact be the greatest opportunity to increase market share since the internet was invented. It is the most disruptive set of circumstances in terms of consumer behavior in at least 20 years, and I don't know that we'll ever see its equal. We have to understand that, again, as difficult as this is, it's also an opportunity because brands and brand preference and brand success, they're not really built when times are good. They're not really built when times are good. Why? Because when times are good, everybody succeeds largely. You don't have to have a disproportionately effective or disproportionately popular or disproportionately resonant brand when everybody's doing well. Rising tide lifts all boats, you see. Brands, however, are truly built when times get hard, when everything around us gets difficult. That's when great brands are created. And in fact, I'll give you an example from here in Bloomington, Indiana, where I live. This is my friend Jeff Wislick, and Jeff is the co-founder of a business called Cardinal Spirits, a local distillery here in Bloomington. And like a lot of distilleries, probably in your areas as well, when the pandemic hit, they pivoted very quickly to making hand sanitizer. Very similar process. You can see Jeff holding a gallon of their hand sanitizer here. They would give out hand sanitizer. They still do with every purchase. You can get booze to go at the distillery as well as takeout food. But even more than free hand sanitizer, they have built their brand during the pandemic, and they did it this way. Every single day they did, and actually still do, publish a post on their Instagram feed every morning that says, friends, thank you very much for your support of Cardinal Spirits. Here's what we need to sell today to stay in business. We need to sell this many bottles. We need to sell this many cocktail kits for takeout. We need to sell this many hamburgers, etc. And then, as happens almost every day, at some point later in the day, they update the post and say, friends, it's now 3:15 in the afternoon. We have been able to reach our goals for the day. Thank you for your support. For the rest of the day, please take your time and money and support a different local business. That's how brands are built. One of the greatest phenomenon in the history of business, and this has been tested in academic settings over and over and over since, I think, the 1940s, if I recall my research correctly. Customers who have a problem that you can successfully solve, or any business can successfully solve, are in fact your best customers. They will buy more from you, they will be more loyal, and they will tell more people about you than customers who had no problem whatsoever. And the silver lining here is that today, Everybody has a problem, and potentially you are the solution. So the psychological conditions for you to build your brand are perhaps better than in any time in your professional career. Now, the financial circumstances, the operational circumstances, the foundational trust circumstances, obviously the health situation circumstances are less rosy as we have this conversation. But on top of that, the baseline consumer psychology scenario is quite interesting and opportunistic indeed. When we think about customer experience, when we think about patient experience and delivering something that creates this belief that, you know what, it was better than I thought and I want to tell my friends, which is what we're trying to achieve here, customer experience is always driven by what I like to call the expectation equation. The expectation equation. Experience doesn't really exist in a vacuum. There really is no inherent customer experience. It is always driven by what you expect will happen and then what actually happens in comparison. The difference between what you expect and what happens is where customer experience is created. So if you expect one thing and you get something way better, that's where a great customer experience lies. And if you expect something and you get something worse, that's where a poor customer experience resides. It happens the same way for every business. It always has been that way. Well, what happens when you have a better than expected experience? Well, those customers become satisfied, and then they have a disproportionate propensity to tell that tale to somebody else. It actually works almost like a bell curve, right? So if they have a great customer experience, they'll tell more people. And of course, if they have a poor customer experience, they'll tell more people. Also, you see this when you look at reviews, which tend to cluster in the 1s and the 5s. Because in those circumstances, much better than you thought or much worse than you thought, you feel compelled to tell somebody else that your experience deviated from your expectation. You can use this premise to deliver an experience that is outside expectations and then create word of mouth accordingly. It doesn't have to be complicated. One of my favorite examples is a restaurant in Sacramento, California called Skip's Kitchen. Skip's is a family-owned restaurant for about 10, almost 11 years now, I think, Skip and his wife. They have never spent a single penny on advertising or marketing ever. Never advertised at all. Because they understand the best way to grow any business is for your customers to do it for you. So how does that work, though? It's a very competitive business. It's a restaurant. They specialize in hamburgers. You know how many hamburger restaurants there are in Sacramento? A bunch. Lots of hamburger restaurants in Sacramento. How do they succeed without spending money to tell people that they're good? Well, they deliver an experience that is outside the expectation equation. It works like this. It's a counter service restaurant, you see. So you walk in and there's a menu board up there. You're all familiar with the premise. And you say, okay, I want a patty melt and an onion rings and a chocolate shake. And my wife will have the same. And then they bring the food out to your table when it's ready. We all know how that works, right? Well, except Skip's does it entirely differently. You see, once you order, but before you pay, the person working the counter pulls out a deck of playing cards and fans them out face down in front of you. And looks you dead in the eye and says, pick a card. And you select a card. And if you get a joker, your entire meal is free, whether you've ordered for just yourself or an entire soccer team. Now, on average, about 4 people a day win this game. And when they win, they go batshit crazy. Right? They're freaking out. They're taking patty melt selfies. They're calling their mom, leaving Yelp reviews. Confetti cannon goes off. It's extraordinary. It is so effective. It exceeds expectations so consistently that in Sacramento, despite the fact they have a giant neon sign outside, as you can see here on the photograph, people don't typically call it Skip's Kitchen. They call it That Joker Restaurant. That Joker Restaurant. Exact same thing happens in your industry. It's about expectations and the expectation equation and how you match up. I just got a brand new PCP. This is my doc, Dr. Sriasian, brand new. Went to him for the very first time a week ago. First time ever. And I could not believe it. Best doctor I ever had. I'm 50 years old. Best doctor I've ever had. On time, early even, which I'm like, what? Incredibly kind, asked really smart questions, and a tremendously good communicator. Explained all the different things that we were talking about and we were working on, and I knew precisely what was going to happen when I walked out of there. Way better than I expected. Now, have I told people about that? Absolutely. I probably told 10 people in the last week just about my experience with Dr. Sri. It can happen. And of course, research bears this out. The bigger the stakes, right, the bigger the circumstances, the more word of mouth matters. The more people will listen to their friends, their loved ones, their family members, their neighbors before making a decision. We did a whole study on this in my consulting firm, Convince and Convert. We do a lot of word of mouth and customer experience strategy as well as digital marketing strategy. We did a whole study on this, and we found that it's literally a linear progression. The more you're looking to spend, or the bigger the stakes, the more you rely on word of mouth before making a decision. So at the very, very top is like weddings. Where should you get married? Like, or wedding rings, or cars, or houses. And then as the stakes go down, word of mouth continues to be really important, but slightly less. And then if you're going to buy licorice, you might not check with anybody, because what's the downside of bad licorice? Like, just still pretty good licorice, right? Well, in your world, what are bigger stakes than right now? The stakes are truly life and death. Word of mouth matters now perhaps more than ever, and it mattered a lot before. 60% of patients choose a hospital based on word of mouth from friends and family, and that data comes from before the pandemic. Before the pandemic. Right now, if you can't get people, real people in each of your communities telling each other that their experience with you exceeded their expectations, nothing's going to change. They're not going to come back until they hear it from their friends and their neighbors. We're going to talk about that here in just a second. I have for you today, and thanks again for having me. I just want to reiterate that. I really appreciate the opportunity to work with you in this terrific event. Judy and the whole team have worked so hard to put this together online for you. It's much more tricky behind the scenes than it may appear. So thanks again, and good job. I want to talk to you about 3 steps. 3 steps to create positive conversations and boost your business even in the midst of all this craziness. And the first one, so important, is we have to close the uncertainty gap. The uncertainty gap. Nobody knows nothing about nothing right now. Nobody knows anything. Things that we used to take for granted, you can't take for granted anymore. In fact, I had on my podcast recently, Laurie Meacham, who is the head of social media customer service for JetBlue Airlines. And she told me on the show, Social Pros is the name of my show, she told me on the show that their digital team had seen a huge spike in searches for the phrase, "Are airlines still in business?" Are airlines still in business? That, friends, is a search term that was not typed into Google very often circa February. And now so often that it was actually noticed by their digital team. Nobody knows nothing about nothing. I'll give you a personal example. A week ago, I sort of did all my things at once, right? Went to see a new doctor, and I also got my haircut. Thank you very much. I appreciate your silent applause. I am a 50-year-old man. I feel like at this point in my life, I have a good handle on how haircuts work. Right? I'm not a professional haircut artist, not even a professional, haircut customer. But I feel like as much as anybody who's gotten a regular haircut his whole life, never have had long hair, I feel like I have it down. Don't anymore. I thought I did, but now I don't, because I decided I had to answer 16 different questions just to get my hair cut the other day. 16 different questions, right? So things like, is the haircut place still open? Some aren't. Is the person who used to cut my hair still at the haircut place? Don't know. Do they still take appointments? Are the appointments the same length? Do I just show up? Is there a lobby, or do I text them from the outside? Do I park in the same place? Do the parking meters still work downtown? Do I shampoo my hair first, or do they still do shampooing? Do I wear a mask? Does she wear a mask? Do you still sell products? How do I pay for the haircut? How do I compensate their haircut stylist with a gratuity? How do you make future reservations? And on and on and on and on. 0 of those questions occurred to me the last time I got my haircut. And now I had to rewire the entire process by which I go and get a haircut. Now imagine you replace haircut with, I don't know, spleen or in my case, possibly gallbladder. I might have to get my gallbladder out maybe. We'll see. Dr. Sri's not sure yet. But gallbladder removal. Okay, so haircut, pretty simple, 16 questions. Gallbladder removal, I haven't written them down yet. 50 questions? 60? 1,000? I don't know, a lot. A lot more than I would have had in February, which is why the number one thing you can do, and why it's the first step, is to create, friends, the ultimate FAQ. And the ultimate FAQ is your best builder of trust. It's your best builder of trust. Do not make your patients and caregivers, even physicians, hunt around everywhere to get questions answered. It was super annoying and frankly difficult for me even to get my hair cut. I had to go all over different places. Sometimes I had to get some off the website, got some from Google, had to call a few. Some lessons I learned once I got there. That is not exceeding expectations. Let's talk about this FAQ. Few things it needs to be. Number one, your FAQ needs to be complete, right? You need to actually answer all the questions. Not just some of the questions, all of the questions. And I looked at a lot of your websites before I put this presentation together. Many of you have FAQs about safety and about health and about COVID on your websites. Great job. But, little fun fact, a lot of people want to share that information with somebody else in their world and talk about it over dinner. Should we get that gallbladder thing or should we put it off? And I saw very few. In fact, I can't think of any. And if you are already doing this, I apologize. But I looked at a lot of sites and didn't see any of them. There is no way to take that with me. There is no portability of your FAQ. It's just a long web page. And unless I'm busting out the laptop over taquitos, that's really challenging for me to talk to the family about. Instead, I want you to think like Joe Manusa. Joe's a realtor in Tallahassee, Florida, who specializes in selling homes. He doesn't help you buy a house. That's not his gig. Specializes in selling homes. And he focuses on the lower end of the market, the part of the market where you may not have a ton of upside equity in your home. Your mileage may vary, obviously, but generally speaking, not a ton of equity. And in that circumstance, as you may know, it's very common for potential sellers to think, yeah, sure, I could use a realtor, or I could try and sell this sucker myself and not have to pay any commission, right? You know what I'm talking about? Well, Joe understands this. But instead of writing a web page that says, let me tell you all the good things about me being a realtor and why you should let me sell your house, which is how everybody else does it, frankly, he sat down and wrote a 63-page, totally free, downloadable, comprehensive PDF that you can download or print from your website. It's called How to Sell a Home on Your Own in Florida. Word for word, step for step, who to call. Here's the documents to find out. That's what you need, an FAQ that is complete and portable, okay? Second thing your FAQ needs to be is concrete. This, again, uncertainty gap is the main problem here. Closing the uncertainty gap. This is not a time for, here's what we're trying to do, or here are some of the things that we're working on. This is the time to show, not tell.
In these uncertain times, we are here for you. Beaumont is leading Michigan through the COVID-19 crisis, and we will help lead the way out. Our expert doctors and caregivers have created a secure environment so you can feel safe coming to us for care. If you have life-threatening symptoms, go to one of our emergency centers. If your surgery was postponed, call your doctor. They're ready to help. I can assure you, Beaumont is safe and ready to serve you.
Okay, that's pretty good. I saw lots of evidence of videos just like that from lots of different one of your sites. You know, it's here's a credible person, right to camera, it's safe, it's going to be amazing. But they're just telling me. You're just telling me something. Let me show you a different video and you'll be able to tell the difference right here.
As you can imagine, during the global pandemic, there has been a very large emphasis on cleaning and disinfecting in order to prevent the spread of COVID-19. Our team of environmental services technicians are highly trained to help break the chain of infection to prevent the spread of infectious agents like COVID-19 throughout our facility. We have worked diligently to increase the frequency of cleaning, especially focused on high-touch items like doorknobs, elevator buttons, and waiting room furniture.
See the difference? Show, don't tell. Third thing in your FAQ is to be consistent, right? It needs to be everywhere and it needs to be the same everywhere, okay? You want to make sure that wherever people see your information, it matches up, okay? So this is an example, again, from my haircut place, which I love it. It's a fantastic salon. I think they do a pretty good job. But one of the challenges I had, and one of the reasons those questions were so difficult, is that depending on where I was, Instagram versus Facebook versus Google versus their website, I was getting conflicting information. And now when things change faster than ever, it is imperative that you keep it consistent in all the places. Fourth thing your FAQ needs to be is quick. Quick. When people have a question right now, the entirety of the time that uncertainty gap is not closed, it is creating angst and ennui and sort of mental dissonance. And there's no way anybody's going to come in for a procedure during that period. So the best thing you can do right now is to be fast. If somebody has a question, answer it immediately. Don't wait an hour. Don't wait 24 hours. Don't wait 2 days. If I were running a program like yours, I would be reinvesting effort into making sure that we can answer questions. However, text message, hostage note, doesn't matter. However somebody's asking questions, I would be trying to provide those answers instantaneously. And right now, psychologically, a fast no is way better than a slow maybe for just about everyone. And you can do this. You can be faster. You just have to you just have to do it, right? You just have to put effort into it. This is Bogdanoff and Dodges, Paul and Tim. They run a small accounting firm in Indianapolis, just up the road. And look, they're the same as every other accounting firm in America. Small accounting firm, 4 people, Paul, Tim, associate, front desk person. They do personal returns, small business returns, a little tax advice. No differentiation, same pricing as everybody else. But they have really focused on speed. So much so that they answer every phone call and every email from every client every time within 5 minutes. Within 5 minutes. And that closes the uncertainty gap ASAP and creates a ton of word of mouth for their business because it exceeds expectations consistently. I think this is also an important time to communicate not just however it is convenient for your business and how you are oriented and organized, but to communicate how your patients and caregivers want you to communicate. And that may mean doing some things differently. Texting, for example, is now the preferred method of communication for all cohorts, including people that are 60 years or older. So if you're not leaning into being available via text, whether it's for FAQs or appointment setting or confirmations, I very much suggest you look into that as soon as you can. Second step for you to consider is to change the messenger. Don't just change the message with the FAQ, also change the messenger. The reality is that, and this was true before the pandemic, but I think the pandemic has helped it along certainly, we trust people more than ever. And we trust institutions, even yours, less than ever. So the more that we can get actual people, real people, even if they work for your institution, the more we can get real people to inform our patients and caregivers, the better off we'll be. Let me show you an example here from a terrific live video from University of...
Hello, and thank you for tuning in to our Facebook Live Q&A, where we'll be discussing how to keep yourself and your community safe as we continue to navigate the COVID-19 pandemic. I'm Elizabeth Van Camp, and I'm a member of the UI Healthcare social media team. I'm joined by UI Hospitals and Clinics Chief Medical Officer, Dr. Teresa Brennan, who will be answering your questions about the still present risks of COVID-19. So please submit your questions and concerns you have in the comments, and we'll answer as many of them as we can.
Love that example. It's live, so it's not pre-programmed, trustworthy, real director of medicine from the hospital. I really love that example. And you also notice, maybe you've seen this in your own analytics if you've done some live videos. I looked at a lot of YouTube videos that you all have created about we're safe and come back, etc. Most of them don't do very well. There's a few that maybe helped along with paid and you treat it as a commercial that have pretty good views, but most of them don't. But the Facebook Live videos, in almost every case, substantially better exposure, something to think about, I suggest. If you can get patients, actual patients, and their caregivers to create user-generated content about their experience with you, that is even better. And you might think that's impossible, but it's not. Nordstrom's, for example, it's not a dissimilar circumstance from what you have. A lot of people are like, yeah, you know what? I could use some new clothes or some makeup or some jewelry or whatever the deal is, but I'm not sure I want to go to a big department store with a bunch of people right now, even if they are all wearing masks. I get it. I'm that person also. So what Nordstrom's has tried to do to rebuild confidence is actually reach out to influencers, real customers, and encourage them to create content on Instagram that tells people that it's actually fine to come back to Nordstrom. So this is actually a program they launched recently. Here's an actual post from one of their influencers, and it says, as an excerpt of the post, everyone was wearing masks, practicing social distancing, and they were incredibly kind. If you can get actual patients, probably difficult for caregivers because they're usually not allowed in most places, but if you can get actual patients to create content either during or after their visit to you, obviously understanding HIPAA requirements and some other things, but if you can make that happen, definitely a terrific opportunity to rebuild trust. Change the messenger, not just the message. And make that personal connection, right? This idea that look, we're not just the healthcare institution in your city. We're a collection of amazing people trying to save lives. I love what Loyola is doing. Loyola is actually placing one-on-one phone calls from hospitalists, other physicians, to patients, previous patients, to say, hey, just want to see how you're doing, want to let you know that we're open, want to let you know that everything's safe. If you have any questions, please let us know. Is that easy? No, it's not easy. Does it make a huge difference? Absolutely. I know this to be true because I wrote a book partially about this gentleman, Dr. Glenn Gorab. Glenn is an oral surgeon in Clifton, New Jersey. Difficult market. Excuse me just a second. Take a little drink here. Difficult market because there are quite literally hundreds of oral surgeons in his region. They all do the same thing. It's not like somebody's got some special procedure. And they all charge about the exact same thing. Hard to differentiate. But Glenn does. He exceeds expectations. He creates conversations by doing something very personal, changes the messenger in a way that nobody else does. Every Friday, his office staff gives him a list of names and phone numbers. And on Saturday, he calls those people. Says, this is Glenn. I'm your oral surgeon. I understand that you're coming to the office for the very first time next week. Before you get here, are there any questions that I might answer for you? People cannot believe it. Because you've probably had an oral procedure of some kind. I suspect you have, haven't you? Wisdom tooth, root canal, whatever. And if you have a good oral surgeon, they'll call you that night, right? Following. Like, hey, Jay, how you doing? How's the pain? Are you bleeding to death? That's what they ask you, right? It's always those three questions in that sequence. But you've never had a physician call you before you ever set foot in the office. It's just not done. But it should be done. I love how Loyola is doing it. And I can tell you it works because Glenn told me that 75% of his patients mention his phone calls when they get into the chair. 75%. And every single day, somebody calls his office or texts to make an appointment and says, I have to drive 5 miles out of my way. I have to pass up a bunch of different oral surgeons to get you, but I want you to be my oral surgeon because Dr. Gorab called my friend Shirley before she ever even set foot in the office. It absolutely works. Again, is it easy? No. Will it pay off? For sure. Third step, friends, is to build an empathy engine. Build an empathy engine. In many cases, how you say something matters significantly more than what you actually say. And we are right now living in an era of empathy deficit. An era of empathy deficit. I think we all know it. Look, I am old enough to remember, and many of you are as well, I suspect, a time when treating each other with kindness and dignity and humanity and respect, we just called that business and life. And somewhere along the way, we lost our way. And we find ourselves where we are here, which is that in business and in life, and certainly in politics, treating one another with empathy isn't the default anymore. And that makes me really sad, actually. But as a consultant, I will tell you it's also a tremendous opportunity, because now when you are disproportionately empathetic, it actually exceeds expectations in a way that wouldn't have in the past, and creates conversations and gives people something to talk about, which will rebuild trust and bring people back to your facilities. So my friend Chris is a graphic designer. He actually lives here in Bloomington, and he has a cat. And I have a cat as well. Although, look, you don't really have a cat in a classic sense. It's not like a dog or a parakeet or a fish. I live in a house where a cat also lives, is a better way to say it. Cat is not in here. Cat is not allowed in here. But I have a cat. Chris has a cat. Many of you may have a cat, I presume, maybe. Those of you who have a cat will know that cats tend to vomit at random intervals. They just do. It's the hairball effect, right? I guess. It's a known bug of cats. Chris, maybe because he's a graphic designer or just, I don't know, risk taker or bad decision maker or some of all of those, in his house down the road here, he has all white carpet, whole house, wall to wall, both floors, all white, snow white carpet. Like he's Jay-Z or something. Well, Chris's cat does the thing that cats do every once in a while, hairball, white carpet, cat staining the carpet. Chris is that guy. We all know that friend, right? Who just, is indignant about things. Chris decides to send an email to the Meow Mix brand cat food company, the manufacturers of his preferred brand of cat food, asking them in all seriousness to only make their food in neutral colors so that the cat will not stain the carpet. And as you might suspect, he didn't hear anything back because that is a crazy email to send. But again, Chris, being that guy, you all have this friend, he says, I'm going to take it public, man. I'm going to take it public. So he goes to their Facebook page where they have 450,000 fans, and he leaves this message. I'm going to play the audio of you. This is word for word what he said. You ready? Here we go.
Dear Meow Mix, cats throw up pretty regularly. I figured you guys would realize this, being cat experts and all. With this in mind, why do you insist on putting dyes in your products that cause ruined carpets, furniture, etc.? When Kitty spews her half-digested meow yuck all over the place. Seriously, my cat doesn't give a shit what your product looks like in a bowl, and neither do I. What would be helpful and appreciated by legions of cat owners, I'm guessing, is if you take the worthless dyes out of your product and save us all a lot of frustration and ruined fabrics.
So Chris is upset, as you can tell. Meow Mix decides to answer him on their Facebook page. They decide to answer him in public. Okay, again, this is in front of as many as 450,000 people. Here's exactly what they said, word for word.
Hi, Chris. All Meow Mix products are made with nutritious quality ingredients that meet the standards and specifications of the U.S. Department of Agriculture, USDA, Association of American Feed Control Officials, AAFCO, and the Food and Drug Administration, FDA. If you have further questions, our consumer affairs team will be able to help you. You can reach them at 1-877-MEOWMIX, 877-636-9649, or by visiting meowmix.com and clicking the Contact Us link at the bottom of the page.
Raise your hand if you feel better about the Meow Mix company now. No takers. They made a classic mistake. Look, okay. Everything they said was true. 100% factually accurate, but an emotional desert. What they did was a classic error. They tried to information the customer to death. And let me tell you, every time you're dealing with a customer, a patient, a caregiver, a physician, a member of the media, it doesn't matter. Every single time, my friends, remember. Empathy first, information second. Because in most cases, they don't care about the information at all. They just want somebody to say, man, that sucks, we're sorry. It's an easy trap to fall into in medicine because there are so many facts and figures and rules and specificity and information, and you're trying to be very, very factually correct because partially from regulatory concerns, partially just the nature of the work that you're in, but empathy first and information second. And that's one of the challenges I have with some of the FAQs that I have looked at of yours already and some of the videos as well. It's well-intentioned. It really is. I appreciate the effort and I hope it works for you. But it doesn't have any actual empathy. A lot of it is like, let us prove to you how smart we are. Let us prove to you the science of how clean we are. Let us prove to you factually that it's safe to come back. And the facts don't matter. You're seeing that right now. The facts don't matter. Of course you're clean. Probably the cleanest place in the world to go. The facts don't matter. Empathy is what matters. There's a business called Wink. Wink makes a frozen dessert concoction. It's sold in the cardboard pint container, so you might see it in your grocer's freezer case next to the Haagen-Dazs and the Ben & Jerry's and that. But Wink is a super different product because it is nut-free, soy-free, gluten-free, sugar-free, fat-free. It's basically pleasure-free. My wife has a lot of food allergies, as does my son, so I understand the point of a product like Wink, but it's not for me, and it's not for a lot of people. And this was made perfectly clear by one of their customers who went on their Facebook page and left this little note. Again, this is in public.
I just bought this hoping to be able to enjoy some ice cream while on a low-carb diet. Too bad this ice cream, I put it in quotes because it tastes nothing like ice cream other than being cold, is absolutely disgusting. I got the cocoa dough version, and literally licking the freezer burnt eye shavings from inside the freezer would probably taste better than this. It's definitely going back to the store for a refund.
Didn't like it. Didn't care for it at all, ladies and gentlemen. What a lot of times we would do is we would try to information that customer to death and talk about why it tastes this way, whatever. Wink didn't do that. Here's how they answered it. Again, this is in public.
Hey, we're sorry to hear this random musings. While Wink is definitely not ice cream, we do aim for an ice cream-like experience. The creator of Wink is a 25-year-old named Gabe who has celiac disease and dairy intolerance. We do recommend letting your pint sit out for a few minutes before you dig in. If the store you purchased Wink in gives you trouble with the refund, please let us know. While we hope that everyone will love and enjoy Wink as much as we do, we realize that not everyone will. If we can help, please send us an email to info@winkfrozendesserts.com. And thanks for giving Wink a try.
You can hear the difference. More importantly, you can feel the difference. Information versus empathy. And in this time of empathy deficit, more important than ever to get that right. Sometimes the more you know, the less you feel. It's the curse of knowledge. And that's one of the challenges that I think you are faced with. You know so much about what's happening in your own facilities. And you feel that the way to win this fight and regain trust is to communicate all that knowledge factually. And how that's interpreted is that it is the emotional desert that we talked about earlier. So think about how to be more empathetic and less informational and see how that works for you. Because the reality is, are you trying to convince people that they should come back? Or are you trying to understand why they might not be ready to come back? Those aren't the same things, are they? Are you trying to convince them rationally, or are you trying to understand where they're coming from and then address that empathetically? Different way of approaching it, and probably a different outcome as well. I really believe this. The next 5 months will steer not just your success, but my success, everybody's success for the next 5 years. The next 5 months will dictate the next 5 years. That's how much consumer preference and purchasing decisions and trust and experiences are shifting under our feet in real time. So I want you to remember the 3 steps. First, close that uncertainty gap. Second, change the messenger, not just the message. Try to communicate with real people, to real people. And third, build an empathy engine. Less information, more empathy. If we can do those 3 things, I believe you will exceed expectations, you will create conversations, and you will rewire those relationships that you so richly deserve. Thank you again on behalf of all of you for having me here. It's been an absolute honor and a privilege. I'm delighted to be part of the event, not just this morning, but for a little while longer today as well. Please, let's get into a few questions, and we'll get on with the rest of this terrific event. Thanks again.